Hi, everyone. Welcome back to the Be Her Village podcast. I'm your host, Kaitlin McGrayas. I'm a mom, a doula, and the founder of Be Her Village, a gift registry for support, not stuff. Today, I'm interviewing Natalie Toshkoff, who is the founder of Take Flight PT, and she specializes in pelvic floor physical therapy. Our conversation is so good. We go in depth into what's going on in women's maternal health care and why doctors are not referring to pelvic floor PTs when they should be, and how we can change that, and also into the benefits of pelvic floor PT and why every single person should be getting pelvic floor checkups. Never even heard of that concept before this conversation. And why we need to take the shame away from conversations around bowel, urinary, and sexual dysfunction. We can live better lives. So tune in and tell me what you think. Thanks. Hi, Natalie. How are you doing?
Hi, I'm good. I'm excited to be here.
Yes, thank you so much for coming. I'm excited to have this conversation. I think that pelvic floor, the existence of a pelvic floor and the need to nourish it, restore it, and think about our pelvic floor is still sort of a foreign idea for most people who are having a baby, most people who are getting pregnant. And I'm so excited to talk to you about all things pelvic floor today because it still admittedly feels a little mysterious to me. Even though I've had many pelvic floor PTs explain it to me and I've been to a pelvic floor PT, I think that the whole area, the whole region, we're sort of like disconnected from. And we only sort of like find pelvic floor PTs and pelvic floor restoration and pelvic floor physical therapy when something is wrong. And so I would love to sort of have this conversation in the context of maybe before something goes wrong, what should pregnant people, people who are growing their families or just even people. And I'm specifically using the word people because everybody has a pelvic floor, which is not
Mhm.
necessarily a known fact. So I'm not even sure necessarily where to begin, but maybe we can begin with what is a pelvic floor and why should we care about it?
Yeah, so the pelvic floor is kind of like the base of our trunk, right? So it's called a floor for a reason. So I always like to think of it as part of the system of our trunk. And by trunk, I mean kind of like the middle section of your body. So there's a physical therapist that developed this, that used this image of the trunk as kind of like a soda can. And you can think of your spine in the middle. You can think of your tummy muscles in front, your side, but like abdominal muscles, your back muscles. And then on top, we can think about the diaphragm, which for people who don't know, that's something that separates our heart and our lungs from kind of our abdominal organs. And so the pelvic floor is just the bottom of that, but it's working as part of this larger system. You're absolutely right that people are more aware of it when there's a problem, and they tend to feel then the pelvic floor gets all the slack, right? Because you're leaking or you have pain with intercourse or something's going on there. And obviously, people think there's a problem with that. And that may be the case, but it's always really important to remember it's not working in isolation. So we want a good pelvic floor physical therapist will look at the system as a whole. And you're right, both what men and women have a pelvic floor. Obviously, different contexts for different people seeing me, but these pelvic floor issues can span the lifespan. So we're talking from pediatrics all the way to older age. So it's not just, this perinatal population, although that's when it gets popular because obviously people are thinking more about what's going to happen during childbirth. And I agree with you. I think that it's tough because there's not a lot of education in our school systems, in our families. It can feel taboo. So there's a lot of basic information that we're not getting, and I would love for that to change. And I would love for people to have that understanding, and then for people to also know what we do and how we can help so they're not suffering needlessly for long periods of time.
I love that. So just as you're talking, I'm thinking about my mom friends that my children, my elementary age children
Hmm.
go to school with. And so I feel like there's like a little bit of like I have two worlds. I have multiple worlds that I live in, but like, I've got my birth professional world. I've got you and I could have this conversation at a level that would
Hmm.
probably confuse people because we would be talking about mechanics and, all these things that we assume people understand. And then you have like my mom friends who I love. They're my friends, but like I sort of call them my mom friends because that's how we connected. And they don't know about this world. They don't know that pelvic floor PT should be the standard. They don't know it exists.
Hmm.
And I remember a few years ago, I was sledding with my children, and me and a couple of my friends were standing around, and one of them made a comment about peeing, about like, I can't do that because I'll pee. And everyone around the circle was like, yeah, no, me too. And
Hmm.
it surprised me. It surprised me, it shocked me, and it saddened me like all at once. I was just like, "Oh my goodness, you guys didn't get pelvic floor PT. You don't even know what it is." And here you are. Your kids are like, their kids were like 8, 10, 12, like they were older, and they're standing there having a symptom and thinking it's normal, normalizing it for one another.
Right.
And the idea of like, oh, this is common but not normal. That's my one of my favorite phrases because I think there are so many things that are wrong with our system that systemically we like lots of people are affected by it. So lots of people are peeing their pants, lots of people are avoiding exercise, lots of people are, running to change their underwear after they sneeze because they think that's normal, but it's actually not normal. It's just really common. And I think about like how those women are sort of like that's the norm right now is you just go, they all got their standard OB care, many of them had C-sections, nobody got handed a pelvic floor script at the end of their 6-week visit. And even now they're dealing with this incontinence issue and just thinking that this is how life is now that they've had kids. They still have not pursued pelvic floor PT. So how do we for just like how do me and you like let's brainstorm on the podcast, but also like what do the people who are listening, what do they need to know? What is the message to people who are not there yet or even who are there? Like what is the message we need to get about pelvic floors and pelvic floor therapy out there?
I think in the context of leaking or incontinence, the message, whenever I do a workshop or a free webinar, I'm always, to echo what you said, I'm always saying you're here today. You're learning that this therapy can solve this problem, that leaking is treatable. And I want you to go and tell 2 or 3 people, even if it's uncomfortable, right? I want people to take the information and share it, because it's like you said, the information isn't there, or there's a family, like there's kind of like a discourse of like in the family normalizing it or among friends normalizing it. And then I also want people to know that it's never too late. I think sometimes as moms, we get a little bit like, oh, I should have done this, but now, I didn't do it. And now, and that's not true. So there's no timeline, there's no shame of like, oh, it's over. Like, sorry, you missed the window. That's another myth that we kind of can get over. Like, we can treat you now, even if you gave birth 10 years ago. Doesn't matter because, again, people have this issue even if they haven't given birth, right? So there's no timeline. So I think we can start there. I think that's why a lot of pelvic floor PTs like do a lot of education or free, free webinars, free events. We are trying to spread the word. And then in your group of friends, you were probably the person that like planted the seed of like, oh yeah, like go see this person, or I saw Natalie, like go see her. We don't need to have a high level conversation, maybe, but we just need to kind of present this is a therapy that can help. Um, so I think we can start there, but it's tough, like you said, if you don't have that info, or if someone's not bringing that into the group, right? Like then what? Then there's only so much. We can just hope the information gets there some other way.
Absolutely. And part of the issue is, and I'd love to sort of get your feel for how this has shifted over time, is that it's not handed to you in your doctor's appointment. Your doctor is not telling you, okay, you've had a baby, now is the time for you to think about restoring your body. And that includes getting a pelvic floor assessment or just having some standard routine therapy, as happens in almost every other developed country. They are handing out pelvic floor PT as the standard of care. And I think that there is an enormous level of trust in doctors, despite
Hmm.
all of the failings of our system and maybe the distrust that many of us hold.
Hmm.
Systemically, there is still an enormous amount of trust. Women, like mainstream, most women are going to their doctors and trusting their assessment and trusting that they're getting the full picture of information. And then doctors are not maybe themselves aware of pelvic floor PT. Um, maybe there's a concern about access. You're right. If insurance isn't covering it as the standard, it feels uncomfortable to say to someone, hey, you should have this. And it's like, great, how do I pay for it? Well, it's $300 a visit. Like there's this feeling of like it almost has to, it stays in this niche only for people who seek it out because it's not being brought in through doctors. And then we have to rely on small groups of friends, on podcasts, on our own research, which is amazing and a powerful thing, right? For all of us to become sort of active in our own care and seeking out information. And like, obviously, I'm someone like that. I'm sure you're someone like that. I'm sure the people who are listening are in that group, but there's lots
Right.
of people that are not listening who are just waiting to be told what's next. Can you speak to that, like about doctors referring and what the insurance coverage might look like and access to this care?
Right. So I think unfortunately, it's like you said, there is a systemic problem of doctors not referring and also not really understanding, I assume not understanding what I do or what we do and what we can help with. I think that is a big failing on their part. I mean, personally, as a provider, I can't imagine that being my specialty and not wanting to help my patients and just again, it's also ironic, right? They're not doing the therapy, like they just need to present the information. And I think other pelvic floor specialists who've been on your podcast have brought this up. Like these are in their clinical guidelines, like ACOG, like urology has clinical guidelines for pelvic floor PT as being like first line treatment for many problems. And it's not being practiced, right?
Oh,
So that's really unfortunate. And again, I think there are systemic issues maybe preventing doctors from being the best they can be, but we don't want to let them off the hook either, right? So that's an issue that, again, I can't really understand because as I think a lot of therapy professions were just always learning and learning, 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 right? Um, so that's one problem. Another problem, access wise, is what you mentioned is that a lot of pelvic floor PTs, myself included, may not be in network with insurance. So that can be an access problem financially. You're a lot of therapists that don't want to be dictated by insurance anymore. It dictates their treatment. Unfortunately, a lot of these practices are devoting a lot of time to billing because insurance doesn't want to pay. So it becomes more about how are we going to get paid versus like what's best for the patient.
mm,
I think that's changing a little bit. Like there are more options, but yes, there are people like me who decide to step out of that model, and then you may not be able to work with as many people. I do think in general, having more providers, whether they are out of network or in network, still does increase access because this is maybe helpful for someone listening. It's not that you have to commit to seeing me for 12 visits. Like this is, I have an hour with you. So there are people that come for one visit and I send them with a plan. I send them, they can still get some value out of it. So, the access conversation is complicated. The system is complicated. The system is flawed. And so we have this like dichotomy, right, of people who have to stay in network and people who can afford to step out. I do think one thing that's promising, which maybe you don't know about, and I didn't know about until recently, is that there are physical therapists that are really trying to work on this on the systemic level. I recently, there's a, a group called the Recovery Method. Maybe group is the wrong word, but a physical therapist. She was doing a lot of research, a lot of meetings with OBs in Chicago, and really trying to figure out like what do they need to make this referral like system happen, like exactly what we dream of, right? Which is like you gave birth, you get a list, or you get some education on like this is pelvic floor PT, some kind of like these are some symptoms. If you experience any of these, reach out to a list of providers. And what she found was that, OBs don't have time to, like, they just don't have time. Like, they want that list, they want it ready, and they want to be able to do that, right? That's essentially what she found. They don't want, like, to watch a webinar they just want that. So she is working on building kind of this network that would hopefully we would see this happen. And she's working on, extending it to New York. Karina Lau, who you may know at the nesting place, is kind of involved. So I think that's really great because I do think is kind of like on the ground speaking to these doctors, which is very hard to do. Like, a lot of us, like, we just don't have that kind of access in New York. Like, how do we, no one has time to speak with us, meet with us, ask about things, or ask what we do. So I think that's great. And there's another physical therapist who's similarly working to set up physical therapy in the hospital, like acute care. So just like other people post-op, right, are being seen by PT, we need to set this up for particularly post C-section, right?
Mm.
So we have some players. It's going to probably take time, but I think you're right. We need to come at this in different ways to see what we can do. And the dream is the standard of care. We get referrals. So hopefully, I think the physical therapists working on this have the idea.
Yeah,
But there are still plenty of people that are learning about us through, social media, Instagram, plenty of people.
of course. And I think it's got to be, a multifactorial sort of a situation where you attack it from all sides. That is very exciting, that work that's happening. And I just want to go back to sort of what you said about your own not choosing to step out of that insurance equation and also the struggle to get OBs to recommend things. And those feel like two sides of the exact same issue, right? Because
Mhm.
when you have insurance coverage, it's great. It creates more access for more people, but it also limits you as a provider to short visits, right? In order to make the economics work of getting paid a reasonable living wage, you need to almost become a factory, churning people in and out. And on that other end, that's where OBs don't have time to learn about the best referrals to make. They don't have time to watch a webinar or to learn a new thing. They are through medical school, right? Through residency, it is just constant work and constant moving and not in a way that allows you to sort of do any additional exploration besides what is directly presented to you. And then you get into practice and you have to see a certain number of patients every day. And I mean, we've all been in an OB visit. I'm assuming it's like if you get 15 minutes of their time, you have gotten an enormous amount of time.
That's a lot.
It's a
Yeah.
lot. And I think it's 15 minutes, including like the nurse coming in, asking you questions, weighing you, blood pressure. The doctor would come in for me and just like put some gloves on, or I don't even know, feel belly, talk a little bit, and that's it. You're on to the next. And it's great because I'm sure more people had access to that care, but what level is that care happening? And how does that set up a doctor to really like find out more information to serve their clients well? So there's not a perfect answer for it right now because, some care is better than no care, right? But if we can offer a higher level of care, even if we reach less people, there are solutions there. And it really does feel like that push to get into OB offices and to just educate is going to create a really nice channel of information. I've been listening to a lot of health podcasts separate from the birth space in more
Hmm.
like food and health diet and everything. And it's been really interesting. It's mostly doctors podcasts. So it's like very cool to like hear their frustration, right? And one of the things that they're talking about is like there's so much evidence for health and proper, the way we should be eating, and it's not known within the medical community because of the for-profit nature of it. The new research that doctors get exposed to is from pharmaceutical reps coming in and saying, "Hey, this drug has this clinical trial. You should give it to your patients." That's how they're staying up to date. And it's by the nature of the beast, right? They just don't have the time to go and do a deep dive into every topic that comes across their desk. And so I feel like PT is has a similar struggle as do most of the supports, the postpartum and perinatal supports for new parents, because there isn't like a high priced drug or a high priced option that then drives the sales force for that then drives, these clinical studies and all of that. So it's doctors are can be individually and as a whole infuriating, but there also is this like larger system that they are into, right? They have these student loans, they are like, you don't become a doctor a little, right? Like you have to like go
Hmm.
all in and then try to fill your caseload and try to keep your head above water. It sounds like the work that those groups are doing and that you're doing is the work that's needed in an imperfect system. And thank you for doing it.
Yeah,
Um,
yeah,
I'd love to switch gears a little bit just so that people listening can kind of hear or identify themselves as they're listening, because sometimes we can feel like, oh, pelvic floor PT, that's for someone else. But I would love for you to sort of like
sure.
lay out like who is pelvic floor PT for? Is it for just should we have like a standard visit just because we turn 30? It's sort of like a mammogram or something. Like, is there an age thing? Should it be standard for anyone having a baby or being pregnant? Should it be something our husbands should look into? Like, I'm just not sure. And also, I guess, like, what are the symptoms we might feel that we might be surprised? I think incontinence, honestly, I feel like incontinence people don't even know about pelvic floor PT, but that's one we've already spoken about. But what other
Hmm.
things might have a pelvic floor solution, or at the very least benefit from a consult?
Yeah, so maybe let's talk about those symptoms first because I think they can, again, like they can kind of affect most people through the lifespan. So broadly, we're thinking of any bowel, bladder, or sexual dysfunction. So a lot of the time, people don't know about, for example, constipation or bowel urgency, things, it's again hard to talk about, but things having to do with poop. So we can definitely help with that. Um, that's, I think, a less known issue of our specialty, or maybe less talked about, right? Because people don't really want to talk about it. And then any bladder issues. So we talked about leaking. So also urgency, not making it to the bathroom, frequency, feeling like suddenly you're going a lot, more than 10 times a day. Maybe you're going at night, it's disrupting your sleep. Sometimes people think they have a urinary tract infection, a UTI. So they might have burning, lower abdominal pain, frequency, urgency, but then they get tested, they don't have a UTI. So those can be pelvic floor symptoms driven by muscle tension. Pain with intercourse is definitely a pelvic floor issue. Again, doesn't matter postpartum or not, although we talk about it more postpartum. And then from the male side, so some more less known for sexual dysfunction, things like erectile dysfunction. Again, we talked about more from a pain perspective. So all those kind of under the umbrella of, essentially pooping, peeing, intimacy, we can help with, but also kind of tying it back to we want to not get in the tunnel of the pelvic floor. So we want to also think like, hey, I also have back pain or I have hip pain that's like chronic, it's not resolving. All that is related, right? Because the pelvis, that's related to your pelvis, right? We're not just in this tunnel, in this cave of the pelvic floor. We have to look at the whole container and like look at you as a person as well. But those things can really affect anyone at any time. I think the question of checkups is really fascinating. And, if physical therapy is kind of dream, right? More broadly, forget about my specialty, but physical therapy, can we be like dentists, right? So could
Mhm.
someone come on a yearly basis, uh, or every 6 months, right? Just for a checkup, right? I think there's a lot of people arguing like that would cut down costs, that would cut down unnecessary, pain management, surgery, all these things. I think that would be great. I think from a pelvic floor perspective, general education for everyone would be, we don't education about bowel movements. We don't want to get constipated. We want to have a poop every day. We want it to look like this. We don't want to strain, right? Like lifting mechanics. So how do we manage our pressure? You don't want to. This is kind of an extreme example, but you don't want to change your day job to becoming a professional mover, right? Like we want to learn how to properly lift. Things like again watching out for those symptoms. Um, so that's knowledge that everyone can have. But I think that the checkups would be great. I think if we're talking about perinatal, even prior to having a baby, is like really a great time to have a conversation, right? Like really dreaming, right? Really starting early during pregnancy, postpartum. And then, we're seeing conversation shift now to perimenopause, menopause. So
Mhm.
having the knowledge of like what's going to change with my pelvic floor going through that, how can I support people are talking a lot about HRT, which is great, but there's a lot of foundational health habits we can start around, when we're in our 30s that can support that. So talking about strength training, talking about nutrition, protein intake, you're kind of seeing this in the conversation, but that's a little bit less glamorous, right? Because those are things that are, you have to kind of build a habit, build a routine, but can be really very helpful across the lifespan, like going into our 60s, 70s, when we're looking to prevent falls, prevent hip fractures, prevent, decline.
Yeah. Wow.
So,
You sort of just hit on like exactly where I am in my personal health journey. I'm like, I'm done having kids, So I'm like full steam ahead into like how am I fit and healthy and independent when I'm 80? That is my sort of guiding light
yeah,
right now. I
yeah,
think in my 20s it was like, how do I lose weight? And I'm like, I don't care what I weigh. I just want to make sure I'm active, I'm healthy, I'm alive, independent. So, but it's interesting too. That's very much where my friends are. I think it's just sort of the stage of life I'm in, but it also is it's sort of intersecting like you just said. It's things you should think about in your 30s. People are having babies in their 30s, and it's sort of hard to wrap your head around
hmm,
perinatal, oh my God, well, perinatal and perimenopause sort of being in the same part of your life. But you're right, it's like the things that we need to do to be healthy are really boring for the most part.
yeah. I think,
Or they seem boring, right? When you think about it, it's like, oh, just eat more protein and exercise. Okay. Oh, like
yeah,
it feels
yeah.
good, but it's hard to do. It's hard to do consistently.
It's hard to do consistently, and I think that's something that I often joke with colleagues or with my husband, I call what I do physical therapy because there's a connotation there. And I don't think we have the best PR, right? For it's boring. I'm not going to ask you to exercise,
Right.
like it's not usually passive, right? People like passive things. I think chiropractors get a lot of education on business and people, it's human nature. People like passive things. They like a quick fix. So a lot of the things we're talking about, like you said, are not sexy or glamorous, but they're super important. And so, one of my goals, it's hard, sometimes I only have a handful of hours or less with someone, and they're coming to me for a problem. So, I want to make sure I solve that problem, right? But I also want to give them a little bit more of this context of like, can we get you to start some strength training because ultimately you're a parent and I believe that parenting is a sport. You're an athlete inherently, whether kind of you want to be or not. Like, sorry, like this is the reality, right? Like you need to haul little people places and it's tiring and they're heavy and that's not going away. Like, yeah, they get more independent, but still. So how can we get you stronger so that's easier, right? And then also, like you said, looking a little bit ahead to this is also going to serve you in this big picture view of maintaining your bone density, ensuring you're independent. And I just try to make it as accessible as I can and try to say, it doesn't mean you have to go to a gym. It doesn't mean you're going to be lifting a barbell. Like you're already working with the load. You're already picking up your kids. You're already carrying heavy groceries. It's just reframing it and like how to understanding what are the minimum things you need to do and how can we set this up to make it accessible for you to kind of start working on this skill.
Wow. So when people are coming to you for maybe one of the pee poop and sexual function, which is now I know why pelvic floor PTs have a PR issue because nobody wants to talk about any of those things openly. There's so much shame around them, and it's, man, it must be hard to just sort of like have the answer but know that people are sort of not asking for the help that they need. But when they come to you, it's not just, hey, let's talk about your pelvis, let's talk about your pelvic floor. It's looking at the entire system and the lifestyle things more, or at least paired with the pelvic floor support and PT.
Yeah, I mean, my belief is for those of us that have the time, like if you're in pelvic floor therapy, whether it's OTPT, you need to be seen as a whole person. There's no way it's going to be successful otherwise. So we kind of want to kind of dismantle some of these barriers that people perceive like, oh, she's going to give me 10 exercises and it's like she's going to want me to do them every day. Or, I mean, I don't know, whatever people's connotations are. And I'm kind of like, no, you're a mom with a baby and we're going to give you things that take 5 minutes. Like, or kind of presenting a menu of options or what do you hate doing or why don't the goal right now is just for you to drink more water, right? So we have to look at it holistically, like there's no other way, I think, because it's a unique, and you could argue this for everything, but I always say we're not talking about an ankle sprain. Now, that could be a separate conversation because the way we approach ankle sprains in traditional PT probably needs an overhaul too, but that's not why I'm on the podcast with you, right? So, but it's not an ankle sprain. Like we're talking about your sex life, or we're talking about your marriage, or we're talking about you becoming a mom. Like it is never going to be the same as like I'm treating I'm treating an athlete with an orthopedic injury in a gym. It's never going to be the same, right? And so I really want people to understand like this is why it's different and this is why hopefully it's going to be helpful.
Yeah. Because it's
And
so much
some,
more intimate. It's like it's not just, I'm thinking about like, athletes. My kids are athletes, my goodness. And it's like, their heel hurts, their knee hurts, or this hurts. It's like, okay, you ice it, you rest it, and a couple days later we're fine. What we're talking about, what you're talking about is like these intimate things that sort of
Mhm.
change our, like you said, your marriage. You have sexual dysfunction, your marriage shifts. You have, feelings of incontinence or pain in your pelvic region. That, this is going to sound sort of not scientific, but it like touches a different area of your soul. There's like your pelvic floor and your pelvic region is so tightly connected to sort of like a private place inside of us that is connected to like wonderful feelings and also really dark, shameful feelings. And depending on trauma histories, like there can just be so much there. This is so much more than just going PT for your knee or your ankle sprain.
Yeah, and there's a huge emotional component, and I think that's based in science. We know that our nervous system, right, is intimately tied with our digestive system and with our, bowel bladder. So when we're in a parasympathetic state, so that's kind of relaxed state, we know going way back, there's no predator. We can use the bathroom. We can, be intimate. We can, whatever that may be. But then if on the flip side, if there's, you know, you're in the jungle now in the modern world, there's a lot more different perceived threats, right? Stress, that's going to affect, like, I'm not going to go to the bathroom right now, right? So I don't know if that's a great example for people, but just knowing that scientifically it is tied to our nervous system because of all these functions that are integral to our, like they help us survive, that there is like a reason based in science. And I think that also ties back to people always kind of want to fight me a little bit on the breathing thing. They're like, oh, we're
Mm.
just gonna breathe. But it's like when you're breathing,
Mhm.
you are like we know now our whole all of our tummy like organs are innervated by our vagus nerve. And so you're literally kind of squishing some stuff and it's squishing the vagus nerve. And so actually physically, like scientifically, anatomy wise, there is something happening to your nervous system when you breathe.
Wow.
And we can make fun of it and it's not a cure, and then our pelvic floor gets input too, but it is something to talk about. It is something to be aware of like this isn't just her telling me to breathe, to relax. It's like actually there's something happening there that like we're not aware of, right?
Yeah.
um
I'm
yeah,
I'm listening to you and it just makes such perfect sense. And as I'm listening to you, I'm like, how could anyone just treat one body part? Because obviously they're so deeply connected, but that's part of what's wrong with our medical care today
yes,
is it's so like fractionalized. I don't know if
fragment
that's a word, fragmented,
fragmented.
fractionalized. Um, but it's true. And it's like the idea that our mental health was somehow separated. It's like dental health, mental health, eyeglasses, and then the rest of your body. It's totally a financial thing, but to separate mental and physical health when there's literally science that supports that our stress levels and our mind and our mental wellness is deeply tied to the rest of our wellness. It kind of blows my mind. And it reminds me, here's where my doula roots come up. It's like, it's similar to saying, like, well, there's something wrong with your cervix, it's not opening. It's like, well, yeah, because the lights are on and you're asking me questions and you're poking me. Like, how am I supposed to get into a state mentally
Yeah,
where I can come down and let the physiological process move forward? And similarly, it sounds like you're having people come in and it's like, sure, there's something wrong. There's a dysfunction in the muscle, but it's because of all these other layers that are not right. And if you fix those layers, it helps support the physiological nature of the pelvis. And so like that mental physical connection does not end because labor is over. It's actually just like many other things that I continue to see in my life. Labor is just like that mirroring of the things that are going on every other moment in our lives. It just becomes more exponential or
hmm,
exponentially experienced during that laboring time, but that exists at all times, that our mental and physical health and our stress levels and how we are caring for ourselves and feeling safe, right, whatever that means for each person, can literally impact how your muscles function and how your body functions.
right,
Wow,
yeah.
that feels like a big deal. It feels like a big deal, and it also feels like, well, yeah, duh. Right, like, well, obviously, but it's
I
not
mean,
so obvious.
yeah, I think that that's the gift, right, of having more time with people is trying to give them maybe that experience or try to help them find whatever they're struggling with, support or a different way of thinking about it. Or I think just trying to offer them this, like, I'm going to talk to you like you're a whole person about your problem. And I think no one expects that when they come in.
Mm.
And it's not maybe something you can market or communicate well on the phone, but then everyone is kind of like, we talked about all these different things and and they're kind of like my hope is they start to put it together of like these things are related and obviously I'm validating for them that there is a pelvic floor problem. I do have this training, but ultimately like it's just like you said, we want to connect things because that's how we're going to be the most successful.
Yeah. Do you mind giving us, and I'm sure it's impossible to do like full justice to this, but like somebody is like listening to this going, "Oh man, a few of these things really sound like me." And they
Yeah.
and they book a meeting with you or they book an
Yeah.
appointment with you. What happens in that appointment?
Yeah. So I think that one thing I want people to know is that they have some choice in what happens. And I usually kind of present choices. So we, of course, have the luxury of talking a lot about what's going on, of talking about some history. I ask about all the systems, I ask about past medical history, all those things. We try to kind of have that conversation. And then it just really depends if someone is dealing, like, let's have maybe an accessible example of like a new mom with back pain and then also incontinence, right? So I kind of present some options. I say, I am trained to assess your pelvic floor through an internal exam. Not everyone comes here knowing that that's something we were going to do today. And so we don't have to. If you're comfortable, I can explain to you, like using a model, kind of what it is. It's very different from an OB exam. There's no speculum, no stirrups, so we can chat about that. Or we can kind of focus on your back pain today, like no internal exam, because that's obviously very intimate. And I can assess for that during your visit. If you feel, sometimes people come in and they're like, I can't function because of this back pain. Now, are those two things related? Likely, yes. But I don't know. I've just met this person. So I'm never, you know, we try to be trauma informed. We try to meet people where they're at. And I think that's something different from other providers, right? It's not like, my job is to do this thing and we have to do this thing. It's like, actually, so here's this thing, but we don't have to do it today. We can do it later. We don't have to do it at all, right? And we kind of give the person a choice starting out there. Um, so if it's helpful for people, I can chat about the internal exam. I mean, the assessment
Sure.
for back pain is like, clothes on, we're looking for different motion, strength, different testing, right? The internal exam, the way that I present it using a model, so I'll have a model of the pelvis. I'll kind of explain the anatomy, like we're sitting here, this is the position of your pelvis, show organs, show anatomy. So for, uterus containing organ, uterus, bladder, rectum, show superficial pelvic floor, explain like, this is the clitoris, this is the urethra, vaginal opening, perineum. If they had a child, we talk about this is where maybe you had a tear or some stitches, rectal opening. And then I talk about the pelvic floor as a whole. So I like to think of it as a trampoline or a hammock. It's supporting these organs. Other ligaments are supporting them too. If they're coming in for leaking, I kind of say, so this helps absorb some pressure when you're sneezing, coughing,
Mm.
but also it's part of this bigger system. So there's other things that help absorb the pressure. And that's great for us because if we work on everything, likely that's going to help. And, this is what I would do during the exam. I would wear a glove, use one finger to gently touch the muscles, usually on one side of your hip. You give me feedback. How does that feel? I come out, switch hands, same thing, as long as you're okay. And then, I may ask that I tell them I might ask you to try to tighten around my finger. I might ask you to take a breath in to kind of see what happens for like pelvic floor relaxation. I might have you cough to see, do I feel a lot of pressure? I might have you tighten your tummy muscles to see what happens. So this is all a conversation I'm having with them, like just to introduce this is what I would do. And then I just ask them, like, is this something you want to do today? Or, and it just depends. Some people like know from their own research, or they asked or they have friends and or some people are like, yeah, that's totally fine. Like I want to have as much information as possible. And other people are like, wow, I didn't know this was going to happen today. And I'm like, that's great. You have some time to think about it, no pressure. Like let's do the other stuff that I would probably want to do with them next visit anyway, right?
Mm.
So that's kind of, I think that's kind of the specific pelvic floor stuff, but
Yeah.
also, and I think also sometimes people can be really intimidated, like, oh, are we going to do this every time? And I'm like, no.
Mm.
Like, I also kind of like to take that off the table and be like, this is not something generally for most people that I would do every visit because, again, we're looking at this whole system. So there's a lot of other things I want to investigate. I'm just letting you know because I know sometimes people worry, like, or have some anxiety, like, we're going to do this exam every time.
Yeah, that makes a lot of sense. So I would love to ask you one
Yeah.
last question that I just feel
Yeah.
like we have to just face head on because it's just been so long associated with pelvic floors. What is your take on Kegels?
You had a whole podcast on this, didn't you?
I did, and I would love to hear what your assessment of Kegels are because I think so many people just think if I do Kegels, I'm fine. That's the solution to any of the issues
Yeah.
that might come up.
Yeah. And it's not always their fault because sometimes the doctor's saying that, right? Which
Yes,
is,
instead of handing a pelvic floor
yeah, I
script, right?
know.
They
I
they
know.
say just do some Kegels.
Which like kills all of us in the birthing community, right? Because we're just like, okay, just hand the referral, you don't have
Right.
to. So I think it's a great entry point. Is it the best entry point? Maybe not, but it's a conversation starter for people to realize they have a pelvic floor, right? Because they're like, oh, it's an exercise for your pelvic floor. What's a pelvic floor? And so we can, for some people, that's where it starts, right? Not for everyone. So I think that's generally a good thing. I think that a lot of us who are professionals and who work with these problems, we know that is not the end all be all. So we want to educate people as to why it's not helping them so that they don't feel hopeless, right?
Hmm.
And it's really unfortunate if a doctor tells you to do it and then you feel worse, right? So the reason for that can be pelvic floor tension, right? So if your muscles are very tense in your pelvic floor, which can happen, do we know exactly why it happens? No, because of what you said before, because of the research, right? But that can happen. And so then if you're doing an exercise that is tightening, when the muscle can't fully relax afterwards, it can feel worse. Like that's a real thing that can happen. So I always tell people like, if it was just Kegels, I wouldn't have a job, right? Because you would just get better, right?
Right.
The other thing is sometimes it's hard to know how to do it or what you're doing because we're not taught. So I think those are some issues, and that's why you see a lot of things online of like, you know, that can be very anti-Kegels. On the flip side, Rachel Peroto, who's my friend and a little bit of my mentor, she talks about a lot, and we talk about how sometimes you need it. Sometimes people need to do it. And I think what we want people to understand is like it's may not be your job. Like it's not your job as the person with this problem to figure that out. That's why come in for one visit and we can at least give you something to start with, right? To tell you like, do you have pelvic floor tension or not? Or are you in a situation where you're actually doing like that isolated pelvic floor contraction, which is what a Kegel is? It's like you're volitionally tightening that muscle. Is that going to help you get some coordination back, get some entry point back, right? So again, it's like everything in physical therapy. It's like it depends.
Absolutely.
And so I think I'm kind of in this middle ground, right? Because we can't completely throw it away for the people that may need that entry point.
I love that. I love that answer, and I appreciate you giving it. Honestly, I think your answer just sort of highlighted the difference between getting your pelvic floor information from Instagram and TikTok and going to a pelvic floor PT who can assess you, understand the context of your issues, assess the strength of your Kegel if you need it, teach you,
Yeah.
and also give you so, so much more than that. Because I think that, the social media backlash against Kegels is probably based on the fact that, like it was overused maybe, or has become
Yeah,
like
yeah.
trying to dispel this myth that it's the only thing that you go to a pelvic floor PT and they just recommend a Kegel. Like it's so, so much more than that. And it's exciting that this profession is growing, that access to it, both insurance coverage and also private access. I mean, Be Her Village, people are raising funds to go and access care like yours. It's very,
Hmm.
very exciting. And this is what parents deserve. Honestly, it's not even a need thing. It's what parents deserve. And I remember speaking to this doula who she's American and she moved to Switzerland. And she said, she had one or two of her babies there. She has in-home midwifery visits, 16 of them, 16 visits between coming home from the hospital and the standard 6 week visit. And she said at the 6 week visit, your doctor just hands you, just like off, like not even in a big way, just hands you, like, all right, thanks for coming in. Here's your pelvic floor PT. And she said, and we go to a room with all these other women and we do our pelvic floor tilts and we do all these things and there's like community around it and it's just the standard of care. And
Hmm.
so, I love these types of conversations because I think the message that we deserve more as American mothers it has to trump the individualism of like, I will be fine. I will have my baby. I will go back to work. I will look perfect on social media. It's like, no, do none of that. Do none of that. Call in the people and ask for, demand, like can start understanding how much we deserve as mothers and start by looking at what other people are getting. And literally everywhere else around the world, in the developed world, mothers are getting pelvic floor PT and they're getting it as the standard. And it's something that mothers here, that's the dream, right? Is like pelvic or even just physical therapy check-ins. I'm about to go book a PT appointment for my whole family. Just they're gonna be like, I'm sorry, what's the problem? I'm gonna say nothing. Nothing's the problem. I just want to come in and to be assessed. We'll see how that goes. I'll fill you in. But it's exciting to imagine this world, and I really appreciate you having this conversation and doing that work and pushing this forward because even if one person hears this and goes and recognizes themselves or takes a preemptive step before there's a problem and sets up, a prenatal consult or contacts you so that they have you in their phone, by the time they have their baby. It's very exciting that this is how the information can spread. And it's really vital information that right now we're finding out because we're actively doing that research. So thank you so much, Natalie.
Yeah, thank you.
Can you share, if anybody is listening to this, and I can't imagine somebody listening to this and not wanting more, how can they be in touch with you? How can they find you? How can somebody book an appointment with you?
Sure. So my practice is Take Flight Physical Therapy. You can find us at takeflightpt.com. You can also email us at info@takeflightpt.com. I'm not a huge social media person, but it is there. So same thing on Instagram, Take Flight PT. And again, speaking to what you brought up, the podcast format, we get to have a little bit more nuanced conversations than maybe Instagram allows. So am in the process of starting a Take Flight Wellness podcast just to give people information in like a more nuanced format and also really accessible, like shorter episodes. So you can kind of have some 10-minute episode on like anything if you're wondering, is this a pelvic floor PT problem? So that's how you can find me. And also shout out to you because I think Be Her Village is absolutely part of that, changing a paradigm of looking at services, consumption, around this time in people's lives. So I always recommend that to people, and
Thank you
we're
so
all we're
much.
all working towards something, right?
We are all, honestly, we are all working towards the same vision for the
Exactly. Yeah.
world, and each of us is needed. And I think it's a really beautiful thing how we as a collective profession work together and support one another. So I appreciate you
Yeah,
coming on here. I
yeah.
appreciate you being part of Be Her Village. And this is wonderful. Can't wait to see the impact continue to grow and grow.
All right. Thank you.
That was such an incredible conversation with Natalie. I'm grateful for you all listening. I know that was a longer episode. Um, all of the links that Natalie shared are in the show notes. Check out Be Her Village. Go to our website, behervillage.com. Everything's in the show notes. And also, don't forget to check out our goodie bag. We have tons of free resources from our practitioners that are just like Natalie about pelvic floor health, about baby showers, about preparing yourself for the postpartum time. And they're free, and we'd love to share them with you. So check out the link in the show notes and tune in next time. Thanks so much.